Before COVID, we've been through this last week. Medical tourism is a great source of revenue, tax revenue, all kinds of revenues for many countries, many developing countries. If the country is already highly developed, like South Korea, Taiwan, Japan, or Singapore, and people trust facilities, professionals in these countries, is a big revenue for this country because people not only go there to pay for medical expenses, they need to live somewhere. They need to buy other necessities, groceries, among other things. It literally developed the economies of all these destination countries. And Dubai, I don't know if you've been to Dubai. I think they produce oil. They are rich. So their healthcare is very developed. Even though it is a Muslim country, people go there. It's still cheaper. And all these destination countries were badly affected during COVID. But they realize this is a lucrative industry. They will do anything they can, the government, the private sector, to continue to spur medical tourism. This paragraph just talks about how lucrative the industry was before COVID. And they were affected during the lockdowns, quarantines, among other things. In Thailand, there was a drop of 94% in their revenue. They were severely affected soon after COVID. But they reacted fast, different entities in this country. Because they realized we got to do something to sustain this industry. And there's an index called the COVID-19 Safe Global Soft Power Index, created by a consulting company in London. And medical tourists, they use this index to gauge whether it's still safe to travel to a country or not for medical care. This is one response. You see, people responded soon. And they try to restore confidence of medical tourists. They have vaccination programs for the tourists, for the healthcare providers, among other things. They require testing. This is another response to COVID, to try to safeguard everything. And it's a hassle. They require tourists or those who accompany them to go into quarantine for 2 weeks or 3 weeks after they arrive. So hospitals, all these things, entities, they know and they are willing to make accommodations. They responded quick, as you can see. Yeah, it's okay, we just wait. We just make accommodation in our scheduling. Everything will go fine. And there is a certification program called COVID compliance certification. And if the facilities is certified, tourists, medical tourists may feel safer to go there. So they responded in all kinds of ways. We just see. And this certification is created by an accreditation board in Germany. And when we read another article, there are many compliance certifications. by different agencies around the world to verify that standards are being met in different healthcare facilities. And after COVID, people are more inclined to use telehealth, telemedicine. And healthcare facilities will work with their IT to make their telehealth, telemedicine more user-friendly to facilitate easy access between providers and patients. See, people reacted quickly. And obviously they realize, yeah, sometimes people test negative 2 days before or a few weeks before they book their tickets. And a day before they're about to board the plane, they test positive. I am sure hospital can make the calculations pretty quickly because they know this is a lucrative economic base for their country. It seems that it's going to go on like what one of you told me last week. And elderly, they know it's a bit of a hassle. They may still go to other destinations for certain procedures to save money, especially in highly developed countries like Japan, Singapore, South Korea. These older adults, they know it's a hassle. They need to get tested. But it's still safe to go to these countries, especially more advanced countries I just mentioned, because they have already taken precautions. So maybe we can say that this sector of economy is still going on, COVID or not